Hi, I'm Dr. Lou Papa, primary care physician on Second Opinion with Joan London. And today on Primary Health, over-the-counter medications. Over-the-counter medications are drugs you can buy at the store, and you do not need a prescription from your doctor. They help you feel better by treating or preventing common health problems like pain, stomach or bowel issues, nausea, allergies, and they can also relieve symptoms from the cold or the flu. They're convenient, and generally these drugs are allowed to be designated over-the-counter when they're shown to be safe for self-administering. Now, while they are safe, sometimes these medicines can cause adverse effects and could be potentially harmful. For example, over-the-counter or OTC drugs, as we call them, can cause side effects like nausea, dizziness, lethargy, or bleeding on your digestive tract for some folks, even if you're taking them correctly. There can also be interactions when OTC drugs are mixed with your prescription medications. Duplication of medications is when you take two drugs that have similar ingredients. For example, ibuprofen plus a prescription for anti-inflammatory medication. A combination like that can worsen your blood pressure control, affect your kidney function, and cause internal bleeding and even increase the risk for strokes and heart attacks. Medicines can also cause something called opposition. This is when medicines with active ingredients that have opposite effects on your body can interact negatively with each other. And this may reduce the effectiveness of one or even both medications. For example, if you're on a prescription medication for hypertension that lowers your blood pressure and you take decongestants that raise your blood pressure, these two medications are working against each other. Over-the-counter medications may change the way your body absorbs or processes another medicine. For example, aspirin can change the way some prescription blood thinning drugs work, or a calcium supplement taken too closely to thyroid medication can interfere with the absorption of the thyroid prescription. Very often, your doctor will list some of the medications you take regularly over the counter in your chart or in the electronic medical record to look for these interactions, but the doctor needs to know you're taking them. And while not common, some people do have allergic reactions to certain OTC over-the-counter medications. And signs of an allergic reaction include itching, rash, hives, and breathing problems. And if you've ever had an allergic reaction to an OTC medication, be sure to avoid medicines that contain the same ingredients. And also let your healthcare provider know that you have had a reaction to this drug. And it's important to note that a side effect is not an allergic reaction. So remember, make sure to always follow the instructions on the label. And if you have questions, ask a pharmacist, and be sure to let your healthcare provider know of any OTC medications you may be using and ask if it can interfere with your prescription medications. I'm Dr. Lou Papa. From all of us here at Second Opinion with Joan London, be well.